Dear learners, welcome back to NPTEL online certification course on novel drug delivery systems. I am Dr. Satish Devanapelli, working as assistant professor at Institute of Chemical Technology. So, in our previous lecture, we have started with the targeted drug delivery systems. So, in that we have seen what are the targeted drug delivery systems, and also we have seen the introduction on the transdermal drug delivery systems. After that, we have seen the what are the advantages of target drug delivery systems compared with the conventional drug delivery systems. And with that, we have started some of the basics of the targeting. So, there we have learned the fundamental aspects of the targeted drug delivery systems, and after that later finally we have seen the few strategies of the targeting for the various diseases. So, in that we have discussed active targeting, passive targeting, and some of the levels of targeting we have discussed. So, today we are going to discuss few of the targeting approaches. So, these are the contents for my today's presentation. So, here we are going to discuss on the stimulus responsive targeted drug delivery systems. So, in that it can be classified into two parameters. One is endogenous stimuli responsive target drug delivery systems, and the another one is external stimulus responsive target drug delivery systems. After that, we are going to discuss on the multifunctional approach in targeted drug delivery systems. So, here we will see the basics of stimuli responsive target drug delivery systems. So, here you can read stimuli responsive targeted drug delivery systems are advanced therapeutic systems designed to deliver the drugs specifically to the disease site while minimizing the systemic side effects. So, here you can understand, so based on the site at the disease, so we will target our formulations. Consider in case of cancer, which will in the cancer cell, the tumor microenvironment, which the pH will be very low when you compare with the pH of the blood is around 7.4, but whereas the pH of tumor cells is acidic in nature. So, based on that conditions which are presented in the disease state, so we will target our delivery systems which are called as stimuli responsive targeted drug delivery systems. So, with that definitely your formulation will not go and attack on the normal cells. So, instead of normal cells, it will specifically target to the tumor cells. So, now we can see the other information. These are the smart materials can show response to the microenvironment of particular disease and its cells, either internal stimuli or external stimuli. So, here the internal stimuli which is available at the site of the disease site. Consider in case of tumor or other some of infectious diseases and some of the diseases, so which will the disease state, consider the pH or increment of the redox potential and the increased temperature will work as an internal stimuli, whereas external stimuli, here in the external stimuli we have to provide some external stimuli as in a temperature, magnetic fields, ultrasound. With this, your drug will release from your system, and that will come in a controlled manner and in the localized manner. So, that is the beauty of the stimuli responsive targeted drug delivery systems. Now, you can see we can also classify as we know. So, we can classify as an endogenous, nothing but the internal conditions will here works as a stimuli, whereas exogenous, which is we need to provide external stimuli. So, now these are the various types of the stimuli functions. Now, here you can see the pH and the enzymes which are available in the diseased condition and the redox potential. These will, there are the other things which we will see in the upcoming slides. And here in case of the temperature, ultrasound and the light we need to provide. So, the formulation, the carrier systems or delivery systems will undergo with response to this stimuli, and then your therapeutic drug will release and that can work as a target. So, this everything will happen within the cell or in the disease site. So, with this we will go forward and we will see what are the advantages of stimuli responsive delivery systems. Okay. Now, in the picture also you can see the magic bullets which are reaching to the particular cells with targeting system. Now, here you can see the first thing is that you can expect site specific drug delivery compared with the conventional delivery systems. Yes, you can avoid all type of non-specific targeting, whereas which happens with the conventional delivery systems, that leads to the systemic toxicity. So, you can also avoid such type of systemic toxicity by utilizing the site specific drug release with the stimuli response. So, it specifically go to the disease site and then it will, your drug will release out. Now, as we seen in the previous slides also, this will work as in a controlled and time manner with that the stimuli response. So, definitely the target system, it will reach to the disease site and there it will release slowly based on the efficiency of the stimuli. If the pH is acidic and if you have a pH sensitive polymer, definitely it will release at that particular pH and that will be controlled and the time release based on the formulation strategies. So, that is also one of the advantages with the stimuli responsive drug delivery systems. Now, yes, you can also modify your pharmacokinetic profile and the bioavailability. So, by modifying the stimuli responsive system, you can change your the absorption at the intestine and in the stomach, and also we can expect the high bioavailability compared with the conventional system. Whenever if you want to target for a colon pH, so if you want to avoid the stomach pH, acidic pH, you can modify, you can use stimuli responsive polymers so that which will reach to the intestine or the colon, there your drug will released, which can be used for the various type of the colon diseases. So, with that we can enhance our absorption and the distribution, metabolism and the excretion profile of the drugs. So, if you control that, definitely you will see the improvement in the bioavailability also. Now, yes, this is responsive to the disease microenvironment as we have discussed in case of tumor microenvironment. Yes, when you see the tumor microenvironment, the pH is low and also the temperature is very high because of the high metabolysis. So, with that you can target with the pH sensitive polymers, and also you can use temperature sensitive polymers. So, with that you can target a disease microenvironment. Example is the tumor microenvironment. So, you can avoid the toxicity to the normal cells. Now, the last point is the fewer doses and the better compliance. So, you can reduce the dose because you are targeting to specific site, and definitely the patient compliance will increase. So, and the last point is multi-stimuli response also possible. So, as we have seen, you can take two types of systems like pH sensitive and as well as a carrier system which will respond in a particular temperature. So, you can also use some redox systems. So, with that also you can deliver your molecule, either it may be internal plus external stimuli materials. So, with that you can go with the multi-stimuli responsive systems. So, with that definitely you can avoid the various types of the barriers which are present in the body. So, these are the advantages of the stimuli responsive targeted drug delivery systems. So, now here we will see some of the points on the endogenous stimuli responsive drug delivery systems. So, as we know, these are internal response which comes in the disease site. So, these systems are designed to release their cargo in response to specific biological signals present within the target site. Like as we have seen, change in the pH, there is an increment in the redox potential, and the enzymes also the presence of the enzyme, types of enzymes which will always depends on the type of the disease. So, all these factors, the internal factors, so these are specific biological signals which help to release the molecule from your formulation. So, this targeted release enhances the drug delivery specificity, and yes, that will improve the efficacy, particularly in case of cancer therapy. So, whenever stimuli are mostly recommended for the cancer therapy because of the consideration of the tumor microenvironment. So, now here we will see these are the various approaches we can implement in the stimuli response. So, this is a carrier system, this is a nano system which contains the drug molecules within the carrier. So, with this, by utilizing of the internal stimuli mechanism, you can deliver, you can reach the target site to the for the treatment. So, these are the few approaches, and here one system we are going to see based on the pH stimuli responsive drug delivery system. As I discussed, so pH responsive drug delivery systems have been extensively exploited due to the nature of intrinsically acidic pH of the organelles. For example, lysosome, endosome, if you want to target the cell organelles, so then you must use pH sensitive polymers. For example, is chitosan is the one of the best pH sensitive polymer which are mostly used in the drug delivery application. And the second case, the tumor microenvironment and the inflammatory tissues are low in pH owing to enhanced metabolic rates, that is nothing but aerobic glycolysis that leads to the decrease in the pH in the microenvironment of the tumor. So, this will help to target the tumors. So, this consideration, this function, this endogenous condition will help us to target pH sensitive molecules for the various types of the cancer treatment. So, pH stimuli responsive drug delivery systems are designed to release drugs in response to the change in the pH of the surrounding environment. So, these are specifically will stimuli at that particular pH. Now, here you can see these are the nano carriers which are loaded with the drugs, and these are modified with the polymers. Now, whenever pH change comes, the polymer will respond based on that stimuli. Whenever the pH environment, the molecule reach, the carrier will reach, what happened? The polymer will sensitize, undergo stimuli, and then it will start release the drug from the carrier. So, these are called as endogenous pH stimuli responsive drug delivery systems. Now, here exogenous, very simple here, we apply external factors to the body, which are nothing but by applying the light or by applying by the temperature, magnetic field or ultrasound. With that, your molecules, your drug molecule will reach out from the carrier to the desired site. So, here is the temperature, magnetic and electric, ultrasound and light. With that, it will release the molecules. So, here we need to apply from the external factors. So, nothing but you can control the release whenever, wherever you need, either by putting the magnetic field, by applying the temperature, there your nanosystems or your drug delivery system will reach and will release the molecules. So, now in the exogenous magnetic stimuli responsive drug delivery systems, so here as we have discussed, which will utilize the magnetic. So, here what we are discussing is that exogenous magnetic stimuli responsive systems required a magnetic field. You can see in the figure also. So, when you apply magnetic field, your medicine or your drugs or your imaging agent will release at particular site. So, with that you can expect the control, the localization and also the release and activation of the therapeutic agents at that particular site. So, here it is the external stimuli. So, the internal stimuli which will not help us for the magnetic. We have to provide the magnetic field. So, your active will release at that particular site. So, magnetic carriers are injected into the bloodstream or retained at the target site by the application of external magnetic field or an internal implanted permanent magnet. For example, consider if you want to target your magnetic carriers and if you want to see the images of the cancerous cells in the breast cancer. So, what we need to do? We have to inject the magnetic nanoparticles into the blood. After that, we need to apply magnetic field on the cancer target. Otherwise, you can put the implant permanently at that breast cancer cells. So, your nano system will circulate throughout the body, but it will go and reach to the particular the breast cancer cells. So, that is the one of the advantages of the magnetic stimuli nanosystems. Now, here also you can see, so this is the cancer systems. So, here in the cancer cell you need to apply magnetic field. So, once you apply it will undergo to the particular cells. So, it will undergo the cellular uptake mechanism, then it will release at the particular site. So, this is a schematic illustration of the using iron oxide nanoparticles to deliver the gene molecules at the tumor site. So, these are the advantages of the magnetic stimuli responsive drug delivery systems. So, yes, here is one more other topic which deals with the multifunctional approach in drug delivery systems. In multifunctional approach drug delivery system, it is also known as hybrid drug delivery system, which can carry multiple functions such as which can be targeted for the imaging purpose as well as diagnosis and then for the therapy also. So, but which required various types of the molecules, like Here we can target by using magnetic hyperthermia, photothermal therapy, photodynamic therapy, drug delivery and enzyme based therapy simultaneously. So, which is possible with the one system. With one system we can make imaging as well as targeting to the cancer cells, and also you can use the drug molecules which can be encapsulated in a one system. So, which is called as multifunctional approach in drug delivery system. So, here it contains, as we discussed, multi capabilities in a single carrier system. Now, with one system you can target the particular site, and also you can include stimuli response also. With that you can also control the release rate, and yes, if you use a various types of the polymers, you can also prolong the circulation time, because you can also avoid the fast clearance of the molecules or nanosystems, drug delivery systems from the blood. So, that can also possible with the multifunctional nanosystems. One more interesting factor, that is theranostics, which are also considered as a multifunctional target, is nothing but the same carrier, the one carrier, one functional carrier will use it for the diagnosis, that for the imaging purpose, and the same carrier will use for the disease treatment. So, which is called as theranosis, diagnostics and therapeutical application, which is called as theranosis. So, this is also one of the approach for having multifunctional drug delivery system by using the multi-targeting approach. So, in here also you can see in the picture. So, here this picture represents, it is the one type of cell. So, here you can see the cell surface, the receptors are overexpressed, consider it is a cancer. So, the receptors overexpressed, and you can target by using the ligands, by using the target moieties, the antibody, protein, small molecules and oligonucleotides. You can use it to target the cell, as well as if you want to see the imaging of that cells. So, the status of the disease state, the growth of the cells and the function of the cell, the properties of the cells, which can also done by using the, but you have to load some of the fluorescent or some of the contrasting agents to see the images of the cells. Now, this again it is a nano carrier. It is also works by various the targeting systems. So, here in that you can also load the drugs. So, here we have three approaches. One is imaging, and then targeting, and the third one is drug therapy. So, all this can possible with the one system. So, that is the multifunctional system. With that you can overcome the all type of the biological barriers which are at in the body and the target site. So, with that you can reduce the toxicity and we can improve the efficacy of the molecules. So, here the another approach, that is by using hybrid approach, nothing but as we know in our drug delivery system lecture we have learned about the classification of the nanosystems. One is the organic and the second one is the inorganic nanosystems. So, when you combine this together, which is called as the multifunctional drug delivery systems by hybrid approach. So, here you can combine both organic and the inorganic molecules. So, definitely that will give the high profile compared with the single type of the nanosystems. So, with this you can improve the biodegradability, you can also improve the endocytosis mechanism at target site, and also you can improve the high amount of drug loading. And yes, with this combination of this you can also improve the biocompatibility of your drug delivery systems. So, here multifunctional drug delivery system by the multi-stimuli response. So, you can see here, so these are the physical stimuli, nothing but external, chemical, that is available in the internal within the cell, and the biological, this is also within in the cell by using pH, redox, solvent and glucose and enzyme. So, these are the various types of the stimuli response. So, you can club any of these two, which is considered as a dual stimuli response, either physical, chemical or from the biological. But when you club, when you combine more than two, which is called as multi-stimuli responsive systems. So, here one example you can see here, a temperature glutathione hydroxy peroxide multi-responsive composite nanocarrier based on beta cyclodextrin poly N-isopropyl acrylamide star polymer capped with the ferrocene modified mesoporous silica nanoparticles. So, now we try to understand what is this system. So, this system, which first of all the carrier is mesoporous silica nanoparticles. Now, they are targeting for the cancers by using the multi-stimuli response. So, initially mesoporous silica nanoparticles are capped with the beta cyclodextrin with poly N-isopropyl acrylamide. So, first we have to take the carrier, and before adding of these two together, so it is a star polymer, it is a conjugated cyclodextrin and with the N-isopropyl acrylamide. So, but when you want to conjugate your mesoporous silica nanoparticle and with this polymer, you need some bonds for a conjugation, either it may be covalent or non-covalent, but here to conjugate we need a disulfide bonds. So, for that ferrocene will help. So, see here, so these are the mesoporous silica nanoparticles which are activated for the disulfide bonds. So, then after that we can conjugate your polymers, and then here we can encapsulate the drugs. So, with this system, now you can see what are the functions of all this molecule. Ferrocene will provide the disulfide bond which will help for the conjugation, and later it will help for the reducing site for the increased glutathione and hydroxyperoxide in tumor cell. That is the one thing. And then poly N-isopropyl acrylamide, which work as a temperature sensitive polymer. So, at high temperature in the tumor microenvironment, it will release the drug molecule from the carrier. Now, beta cyclodextrin, it works as a host and guest interactions, it will encapsulate the drug molecule. So, now try to understand this. First of all, we have a mesoporous silica nanocarrier, so which will hold the drugs, and after that we are modifying with the ferrocene to conjugate the polymer. So, with this, with one system we can expect multifunctional systems. So, here is the one more case study for more understanding. So, here pH sensitive polymeric micellar systems which contain chitosan derivative for efficient delivery of the paclitaxel. As we know, paclitaxel is anti-cancer, chitosan shows pH sensitive response, so which are converted into the chitosan micelles. So, here these are the polyethylene glycol molecule, chitosan and hydrogen bond and with the cholesterol. So, cholesterol need to conjugate with the chitosan, further that need to be covalently bond with the polyethylene glycol. So, once the polymer is formed, so with this, with all these raw materials, the scientists synthesized pH sensitive polymer system. So, then they added the drug, and with the self assemble it will form the polymeric micelles. Now, once it is administered to the body, So, based on the pH stimuli as well as the passive targeting, so your molecules, your micelles will reach to the disturbed cancer cells which are not similar to the normal cells, whereas normal cells are very clear, whereas the if you see the first structure of the cancer or blood vessels, there is a lot of damage in the lymphatic drainage as well as there is a leakage. So, these systems will help and retain in the cancer cells which are called as EPR effect, enhanced permeation retention effect. So, that will help for the release of the molecule in the environment, tumor environment. So, first it will reach into the target, that is by passive targeting, and after that it will release at that particular pH. Passive targeting with pH sensitive, which is called as a multifunctional targeting system. Now, we can see here, if you compare the pH of 5, it is showing the good release compared with the other types of the pH. So, similarly, we can see in vivo anti-tumor effect in tumor bearing mice after the treatment. Now, here you can see these are the length of the tumor volume. So, with the taxol formulation, and this is the paclitaxel loaded micelles. So, these are the controls. First one is the control and the second one is the marketed, or you can say the market formulation, and the third one is the pH sensitive paclitaxel loaded chitosan micelles. So, you can see there is a decrement in the tumor volume. So, that is represented here also. You can see the last one, paclitaxel loaded micelles, the tumor volume is very less, whereas other case, so the tumor volume is not decreasing compared with the. So, this is a control, the maximum is the maximum tumor volume. So, now paclitaxel help to reduce this much, whereas the pH sensitive chitosan polymers micelles showed maximum decrement in the pH stimuli responsive drug delivery systems. So, with this example we can understand how the multifunctional or pH sensitive polymer carrier systems will help in the efficient delivery of the various anti-cancers for the treatment of the cancer therapy. So, with this we are going to stop today's lecture. In next class we are going to discuss on various types of the targeted strategies. Thank you so much.